Welcome to this webcast, which is part of the LeadWire series on the oral availability of medication. With me is Dr. Ana Brotons Canto from NewCap's Nanotechnology in Spain. Dr. Brotons Canto, it's great to have you here. Thank you very much for taking the time.
Thank you.
Dr. Brotons Canto, what role do nanoparticles play in your current research?
Well, as you say, I work for NewCap's nanotechnology. So you can imagine that nano and microencapsulation is the core research in our company. In fact, I have encapsulated over 52 active ingredients with different kind of particles. And the active ingredients were quite different. One time was an antioxidant like resveratrol, another time was quercetin, another active ingredient was DHA, a fatty acid, another active ingredient was a drug like insulin or glibenclamide. And we have also encapsulated probiotics. So yeah, we have encapsulated almost everything, and it's an important role in our research.
We can read that the spice turmeric has amazing properties, something that boosts the immune system, while also containing various antibiotic compounds to defend against bacteria. But since curcumin is not soluble in water, does that mean that when we eat turmeric, it doesn't actually do that much?
Yeah, well, when a substance, like the case of curcumin, is orally administered, it needs to reach the bloodstream to have an effect in vivo. In case of curcumin, will be the anti-inflammatory effect. And the way to reach the bloodstream is to go through the different parts of the gut, reach the enterocyte, which are the absorptive area, and then go to the blood. The two main factors to have an activity and to reach the bloodstream are on the first one, the water solubility, as you say, but there is another important factor that is that in the gut we have different pHs, and the active ingredient, such curcumin, needs to remain active during all this journey when it reaches the absorptive area. So, as you say, curcumin is not really soluble, and that means that we don't absorb 100% of what we are orally administered, but we only can obtain in the blood a really small fraction. The supplements, or at least the good supplements, try to improve this bioavailability of curcumin, sometimes by encapsulating the active ingredient to avoid the pH changes, because it will destroy the molecule. And in other cases, you can, let's say, play with curcumin and cyclodextrins, for example, to improve the water solubility of the active ingredient. So it makes sense to take the supplements. Sometimes yes, sometimes not. For example, we have prepared formulation with curcumin and it works better than natural curcumin, and we know that in the market there's supplements that works a little bit better than regular curcumin, but it depends on the supplement. There is another factor that most of times the supplements overdose the amount of active ingredient you need to reach an effect. The problem with this increase on the dose is that sometimes you have some gastrointestinal effects. Sometimes it's diarrhea or sometimes it's stomachache, and that's the reason not everybody is happy with the same supplement, because sometimes let's say the effect in the gastrointestinal area is different from one person to another.
There are specific nanoparticles that can improve the oral availability of curcumin. What is the impact of these nanoparticles and how do they work?
What we have worked in NewCaps is in a formulation prepared with zein, which is the corn protein. And with this kind of particles, we first protect curcumin from the different changes of the pH in the gut, but also increase the time the curcumin remains in the system. How? Because the zein is mucoadhesive. In the absorptive area, we have some mucus to protect the enterocytes, the cells that are in charge of this absorption of substances. If the particles are stick in this mucus layer and they remain more time, that means they can release their cargo in more time than a regular curcumin that will precipitate in the lumen of the intestine, and it will go through the gut in a very rapid way. And by this increase in the mean residence time, we increase the absorption and the chances to be absorbed. And we have a publication, and we have showed that we have increased over five times the curcumin bioavailability with our technology, and we were better than the best supplement in the market right now. So that was a really good need for us.
Do you think these Zane nanoparticles could also be used for other applications? And when do you think it is useful to use nanoparticles to improve absorption and availability? And when do you think it is less useful?
In fact, we have used the Zane nanoparticle not only for curcumin, but also for the insulin, glibenclamide. We have also worked with different antioxidants. In case of resveratrol, for example, we have improved the resveratrol bioavailability about 32 times, which is a really great increase in the bioavailability. And I think it can be useful in every case you have a really low bioavailability. Another example we have is, for example, the case of quercetin that can be used in Alzheimer's disease to improve the symptomatology, the symptoms. And in one paper we have published, we see how the administration of quercetin in our nanoparticles is able to modify and to increase the bioavailability, so we get enough quercetin in brain to have an effect in the Alzheimer's disease mice model. So it has really good opportunities in different sectors. When wouldn't be recommended to use this kind of particles in case of drugs or active ingredients in which we have a high solubility in water and a high permeability, because in that case, they won't need anything to work properly in the body. And to have another limitation, for example, nowadays, the probiotics are quite a hit. And in the preparation of Zane nanoparticles, we need to use ethanol at some point, and the ethanol will kill the probiotics. So this kind of bacteria won't be useful because we will kill the bacteria. But in that case, for example, we work with different proteins that avoid the use of ethanol, and we can prepare the probiotic encapsulation in other matrices without any problem. But in that case, Zane wouldn't be a possibility.
Dr. Brotons Canto, thank you so much for taking the time today, and best of luck with your further research. Thank you.
Thank you for your interest.